Israel continues its military operation against Hamas, releasing video today that it says shows troops operating in Gaza City. The military says soldiers seized a large number of weapons and ammunition. They also reportedly discovered 35 tunnel shafts, but so far have not provided any evidence. The Israeli Defense Forces claim that senior Hamas officials took control of buildings in the area to conduct and direct what it described as terrorist activities. Hamas has been declared a terrorist organization by Canada and many Western nations. Gaza health officials say at least 11 Palestinians were killed when an Israeli airstrike hit a house in a refugee camp in the northern part of the enclave. Heavy clashes were also reported in the camp overnight. The Israeli military has repeatedly called on Palestinians to leave northern Gaza, saying its troops are active in the area. Now, for more on the humanitarian response in Gaza, we're joined live by Dr. Margaret Harris, a spokesperson for the World Health Organization. Doctor, thank you for joining us today. I'd love for you to start off by talking about what we just read. The Israeli Defense Forces urging Palestinians to move south out of northern Gaza. How is that journey for Palestinians on the ground, and is the south all that safe?
Hello, Eden. It's a very difficult journey, especially many of the people who are traveling down are ill, they're starving, they haven't had water, they're very frightened. And you're right, there's no safety in the south either. The entire strip is a war zone, and nowhere in Gaza is safe, unfortunately.
It's been a lot of difficult work for humanitarian groups like the WHO on the ground, but you've been working very closely with other groups on the ground like the UN. Walk me through some of the other organizations you're partnering with now and why this cross-collaboration of humanitarian groups is so important at this time.
It's critical to be able to work together, not just with the UN, but with all the different aid agencies around the world who understand that this is a massive humanitarian catastrophe that we're going to have to put enormous energy and efforts to do something to reverse. One of the first things that has to happen is the ceasefire. But today we have been able to at least evacuate 31 critically ill babies. Some of them really, really fragile, from Al Shifa where they were dying. Several of them had died even before we could get them out. And they've now been moved to a hospital in southern Gaza. But even there, the hospitals are being starved of fuel. There's no fuel coming in, water, food, all the essentials, the medical supplies are all very, very difficult to get in. So to help all the thousands of people who need help, we need a ceasefire and we need to be able to get the humanitarian aid in.
Doctor, you talk about the importance of a ceasefire, but we did hear from U.S. President Joe Biden last night, who put out an article that said a ceasefire is not peace. I'd love you to respond to that statement.
I've never not been asked. I haven't actually seen that statement. But the point of a ceasefire is to stop fighting. This is a man-made disaster. This is a humanitarian catastrophe. We have thousands and thousands and thousands of people dead, but we have 30,000 injured. We've got very few hospital beds. The hospitals are closing one by one because they're unable to, that they have no supplies, are unable to continue to function. We also have huge rises in infectious diseases, in gastroenteritis, in hepatitis, and these are running through the population. We've got respiratory diseases, the lung diseases, the throat diseases. Again, things, as you know from COVID, run through a population and kill people. Now, all those people with those diseases can't get into hospital. They're filled with all the war wounded. So a ceasefire is absolutely essential to just allow humanity to come back into this equation. And indeed, peace is the ultimate goal. But right now, let's just be human.
As this conflict stretches into its 6th week now, Doctor, talk to me a little bit about the status on the ground. As temperatures change, as climates change, seasons change, how is the humanitarian efforts kind of evolving to adapt to that?
It's getting harder and harder because, again, the lack of fuel is one of the critical things, and that's being used as a weapon of war right now, and not permitting fuel in. So that means that the sewage systems don't work. They rely on energy. There's no electricity. There's no fuel to generate electricity. The garbage collections don't work. Trucks don't have fuel. The delivery of supplies from our organization and others, no fuel. And water, there's only 5% of normal amounts of water coming in. There's no food. And as it gets colder, the seasons have changed and it's beginning to rain. You've got large numbers of people who are actually living rough. A lot of them are just sleeping in the streets or in tents. And under those conditions, the cold weather and the rain become unbearable.
An evolving situation, a lot of work for your crew on the ground. Dr. Margaret Harris, spokesperson for the World Health Organization, thank you for sharing your insights with our viewers.
Thank you for having me.